Dr. Edwin Williams, a double board certified facial plastic surgeon with 33 years experience with facial rejuvenation and a facelift specialist. One question to me that pops up and is a big red flag is when someone goes to an injector, and it doesn't matter their education or training, well, it doesn't matter their training, but their degree is not that important. But what is a red flag to me is when they say, my injector only uses whatever product. That's the red flag. And the reason why is that each of these different products have different attributes and are used differently in better places in the face to customize treatment for you. So one question I would ask your provider, and again, there are really good experienced providers, it doesn't matter what their medical degree is in. Question is this, okay? What products do you use as your filler, and the importance of not having one product? I want to explain this to you. There are so many different safe products to use in the face for volumetric restoration. We know that as we age, we lose a little volume, right? There's settling and there's folds, but here's the answer why. Because each one of these products, and I'm going to mention a few of them by name, not that I'm advocating or endorsing any of them, but there's Juvederm and Restylane and Sculptra, you name it, and a bunch of the hyaluronic acids. So why would you use different products? Well, the reason why is because each of these products has different attributes, maybe a smaller molecular structure in the case of, say, Restylane, and they work better in certain areas. For example, Juvederm may work better, and I'm not endorsing this, but may work better in the lips, and Restylane may work better around the eye, and Bellaterra may work better for superficial folds, and they're all hyaluronic acids. So why do providers sometimes stick with one? And this is why I think it's important to ask. Like, what are the products that are being used in my face? Can you tell me a little bit about them? Can you tell me why you use them in that particular area? Well, one reason we see is that if you're a small volume injector, now we have everything here at the Williams Center, you may use what you get that's less expensive because you buy it in bulk. And to me, that's a red flag. I want to know that if you're injecting my lips, you're injecting it with the best product out there, and that you have a variety to choose from, and you're making a decision based on what's best for me, not what's best for your bottom line, because you're getting something in volume cheaper. I'll give you a story. I mean, I'm not endorsing Botox or Dysport or any of the neuromodulators, but went to check out somewhere to use her membership rewards point, only to find out that the time before she wasn't injected with what she thought she was injected. She was injected with, again, nothing wrong with Dysport, but she was injected with Dysport and she wasn't getting a rewards point. And why would someone do that? Well, some people, when they're negotiating, get a better price for certain things. And if you're a smaller operation, you're more likely to do that. So I would question, I think it's very important, and we tell our patients exactly how many units you've been injected, and we chart this in the chart. So to me, that's a red flag. If someone says, well, I use this product because it's the best, I'm not buying it, because they're all a little different. And I want to know that my injector is seasoned and experienced enough to be able to know the difference in the different attributes, to know where they're injecting things in my face and what they're injecting. I mean, this is your face. This is a medical procedure. Don't you want the best? So that's our philosophy here at the Williams Center. And to me, it's a red flag when someone just injects one product.